Major depressive disorder. The most common form of depression. Major depressive disorder, or MDD, sometimes called clinical depression. It's not just feeling sad for a day or two, it can stick around for weeks or even longer, making everyday life really tough. If you're dealing with MDD, you might feel hopeless, really sad, or just numb most of the time. You might lose interest in things you used to love, and your appetite could change a lot, either eating too much or not enough, leading to weight changes. Here are some signs you might notice. Feeling drained all day, even if you've slept well. Feeling like a burden to others or having really low self-esteem. Struggling to concentrate or make decisions. Sleeping way too much or hardly at all. Losing interest in things that normally make you happy. Having thoughts about or experiencing significant weight changes, either losing or gaining a lot. You might feel constantly tired, have trouble concentrating, or be more forgetful. MDD can come with other stuff too. It often shows up with anxiety, and sometimes it's mixed with feeling down during certain seasons, intense physical symptoms, or even psychotic episodes. For some people, it can kick in around childbirth. Dysthymia, also known as persistent depressive disorder. It's similar to major depression but sticks around a lot longer. The symptoms are a bit less intense, but they can really wear you down over time. Here are some signs you might be dealing with PDD. Feeling low most of the day, almost every day. Feeling physically restless or really sluggish, and especially having trouble concentrating, motivation, or making decisions. For dysthymia, the symptoms usually happen almost every day for 2 years in adults, and at least 1 year for children and adolescents to be diagnosed. Dysthymia can be mixed with other disorders just like MDD. It can also range in levels of severity. Typical depression. So picture this, you're feeling down in the dumps most of the time, but then something good happens, like hearing good news or having a fun outing with friends, and suddenly you feel a bit better. That's a typical depression for you. Your mood can lift temporarily in response to positive events, even though you're still struggling overall. But don't let those brief moments of happiness fool you. A typical depression can still pack a punch. You might find yourself dealing with changes in your appetite or sleep patterns, feeling hopeless or worthless, and having trouble concentrating or making decisions. It's like a heavy cloud hanging over you, even when there's a ray of sunshine poking through. The thing is, atypical depression isn't as straightforward as other types of depression, and that can make it tricky to diagnose and treat. Situational depression, also known as adjustment disorder with depressed mood. It's like a cousin to major depression, but instead of just feeling down for no apparent reason, it's triggered by specific events or situations in your life. These events can range from the death of a loved one to serious illness, divorce, abusive relationships, unemployment, or facing tough legal issues, basically, anything that really shakes you up emotionally. And it's completely normal to feel sad, anxious, or want to pull away from others during these tough times. But when those feelings start to take over and interfere with your daily life, that's when it becomes situational depression. You might find yourself crying a lot, feeling hopeless, experiencing anxiety, changes in appetite or sleep patterns, body aches and pains, low energy, difficulty concentrating, and avoiding social interactions. The thing about situational depression is that it usually kicks in within about 3 months of the triggering event, and it can really throw you for a loop. Seasonal affective disorder, SAD. Ever heard of the winter blues? That's basically seasonal affective disorder, SAD, in a nutshell. It's a bit like your mood taking a nosedive when the weather gets colder and the days get shorter. For some folks, it's like clockwork. They start feeling down during fall or winter, but for others, it can hit in spring or summer. One telltale sign of SAD is a sudden craving for carbs, think pasta, bread, and all things starchy. And sleep? You'll probably find yourself hitting the snooze button more often, with a deep longing for those extra hours of shut-eye. All these changes can lead to increased isolation as you withdraw from friends and family without even realizing it. When SAD strikes, it's like a heavy blanket of sadness settling over you. You might find yourself feeling sadder or crankier than usual, with a sense of hopelessness that's hard to shake. Energy levels plummet, making even the simplest tasks feel like climbing a mountain. Concentrating becomes a struggle, and you might find yourself zoning out more often than not. But here's the scary part: thoughts of suicide can creep in when SAD is at its worst. It's like your brain gets stuck in a loop of negativity and it's hard to see a way out. Manic depression. also known as bipolar disorder, which is a group of mood disorders where people swing between periods of mania, really high energy and mood, and depression, low energy and mood. These highs and lows can be unpredictable and might even happen at the same time in what's called mixed episodes. These episodes can last for weeks, months, or even years. Symptoms of depression, the lows, could be similar to the ones from major depressive disorder. Symptoms of mania, the highs, could range from feeling excessively happy, hopeful, and excited. Being restless, you might find it hard to sit still or focus on one thing for too long, always feeling like you need to keep moving. Talking really fast and having trouble concentrating, your thoughts might race, and it feels like your mouth can't keep up with them. It's tough to stay focused on any one thing. Making big, unrealistic plans, you might come up with all sorts of grand ideas and projects, feeling like you can take on the world. Acting impulsively, you might find yourself making snap decisions without really thinking about the consequences, whether it's spending money, starting new projects, or taking risks. Needing less sleep, you might feel like you can go days without sleep and still have energy to spare, even though your body probably needs rest. Anhedonia. Imagine waking up one day and suddenly, things that used to bring you joy or excitement just don't have the same effect anymore. That's anhedonia. Anhedonia can affect different aspects of your life. Social anhedonia might make you feel disconnected from others, like you're just going through the motions of social interactions without really enjoying them. You might find it hard to connect with friends or family, even if you used to have a strong bond with them. Then there's physical anhedonia, which can make it hard to enjoy things like food, touch, or even intimacy. You might notice that activities that used to be pleasurable, like eating your favorite meal or cuddling with a pet, just don't bring you the same satisfaction anymore. Depersonalization derealization disorder. Depersonalization derealization disorder is when you constantly or frequently feel like you're watching yourself from outside your body, or things around you don't seem real, or both. It can be super unsettling, making you feel like you're living in some kind of dream. Lots of people might have a brief moment of feeling like this, especially after a tough experience, but when it sticks around and messes with your daily life, that's when it's likely depersonalization derealization disorder. This condition is more common in folks who've been through tough stuff like violence, abuse, or extreme stress. Psychotic depression. Psychotic depression is a specific type of major depression that goes beyond feeling sad and includes experiencing episodes of psychosis. Psychosis can manifest in various ways, such as hallucinations, where you see or hear things that aren't there, or delusions, where you hold false beliefs that aren't based on reality. People with psychotic depression may also experience other symptoms commonly seen in depression, such as agitation, anxiety, hypochondria, excessive worry about having a serious illness, intellectual impairment, and physical immobility. These symptoms can significantly impact daily life and make it challenging to function normally. Premenstrual dysphoric disorder. Premenstrual dysphoric disorder, or PMDD. It's like PMS's evil twin, showing up right before a woman's period and wreaking havoc on her life. She might find herself snapping at people for no reason or bursting into tears at the drop of a hat. And it's not just her mood that takes a hit. PMDD can mess with your physical health too. Think of cramps, bloating, headaches, and muscle pain, basically. Everything that makes her feel emotionally drained. But here's the kicker: PMDD isn't just a case of the blues that you can shake off. It's a real medical condition that affects millions of women, and it can seriously disrupt your life. School, work, relationships, everything can feel like an uphill battle when PMDD hits. Substance/medication-induced depressive disorder. This can happen when you're using a medication or substance or during withdrawal. The symptoms can include irritability, depressive episodes, bad temper, a sense of hopelessness, and losing interest or pleasure in things you usually enjoy. A lot of people might use drugs or other substances to feel better, but ironically, they often don't notice these depressive symptoms creeping in because of their usage. Depressive disorder due to another medical condition. This type of depression can be triggered by health issues like arthritis, diabetes, HIV, strokes, viral infections, and many more. Symptoms here include a persistently low mood, lack of interest in anything, irritability, and sometimes even an elevated or expansive mood. Postpartum depression. Have you heard of the baby blues? It's a real thing, and it's called postpartum depression. For some moms, it hits within the first few weeks to months after giving birth. Imagine the moms on an emotional roller coaster. 1 minute they're over the moon with love for their baby, and the next, they're drowning in sadness or anger. The moms might also find themselves pulling away from family and friends, retreating into themselves because you feel like nobody understands what she's going through. Eating habits go haywire. They either devour everything in sight or barely are able to stomach a single bite. And sleep? Forget about it. They're either tossing and turning all night or crashing into a deep slumber at odd hours. Disruptive mood dysregulation disorder. If you find yourself having frequent outbursts of anger, either verbally or physically, occurring at least 3 times a week, it could be a sign of disruptive mood dysregulation disorder, DMDDD. This disorder is characterized by chronic irritability and severe temper outbursts, which are disproportionate to the situation. In addition to frequent anger outbursts, individuals with DMDD may also experience persistent feelings of sadness or moodiness, further contributing to their emotional dysregulation. These symptoms typically occur at least 3 times a week and can significantly impact daily functioning. It's essential to note that for a diagnosis of DMDD, these symptoms must persist for more than a year and typically begin before the age of 10. Tips to fight depression. So we all know dealing with depression can be tough, but there are some practical tips that might help you navigate those challenging moments. Here are a few. 1. Give that negative voice in your head a name, like Myrtle, or any name you find unattractive. When it starts telling you those hurtful things, tell it to shut up. You can even get a bit sassy with it, like, "Yeah, shut the hell up, Myrtle. You're a real pain." Sometimes giving that voice a persona can make it easier to recognize when it's trying to bring you down. 2. Create a checklist each night for the next day, breaking tasks into manageable steps and keep it in an accessible spot. As you complete each task, check it off, taking satisfaction in your progress. Reflect on your accomplishments weekly, celebrating even the smallest wins. This method isn't about perfection, but about making progress and regaining a sense of control over your life. Give it a try and see how it helps you feel more productive and accomplished. 3. Make an effort to prepare actual meals for yourself instead of relying on quick, unhealthy options like Hot Pockets. Nourishing your body with real food can significantly improve your overall well-being, even if it's not always the healthiest choice. This simple act of self-care can have ripple effects, encouraging you to shop for groceries more frequently, get out of the house, and engage in activities like cooking and cleaning that promote a sense of accomplishment and routine. Plus, it gives you something positive to focus on, like exploring new recipes or improving your culinary skills. 4. Kick off your shoes and connect with nature by touching the dirt and soil with your hands. Engaging with the earth in this way can have a positive impact on your psychological well-being, which is why gardening is such a popular hobby. Additionally, remember to prioritize basic self-care activities like exercise, brushing your teeth, and taking a shower. These simple actions can contribute to your overall physical and mental health, helping you feel refreshed and rejuvenated. 5. Slowing down and chilling out for just 20 minutes a day can make a huge difference. It's like a mini escape from the hustle and bustle of life. You don't have to call it meditation if that's not your thing. Just find a cozy spot, maybe a quiet corner at a coffee shop, set a timer and let yourself just be. No scrolling through social media or trying to keep your mind busy with puzzles, just soak up the moment. Trust me, taking this time for yourself can really boost your energy, motivation, and overall mental well-being. So give it a shot and remember to take it slow and easy. You've got this.